Greetings and salutations. I'm Jennifer Kennedy, the lead for quality and compliance at CHAP, and welcome to CHAPcast. So what we're going to talk about today is the importance and role of case management in both home health and hospice. And this whole concept of good case or care management is really important for each and every patient. You know, it can make the experience great, or it can make the experience meh. And it's also really important to coordinate with the rest of either the home health team or the hospice team for each and every patient. I am so glad to be talking about this topic with my colleague and good friend, Kim Skehan. What do you think, Kim? Are we going to tear it up with case management?
Absolutely. And you know, I have said this for many years. Case management is a topic near and dear to my heart from the time I was a clinician in the field through manager and leadership, and certainly with survey. We know that effective case management is vital, but often underutilized, a component of that really supports optimal patient management. And from a survey perspective, many of our survey findings, as you know, Jennifer, at the standard level or condition level, and even sometimes immediate jeopardy, are related to care planning, assessment, follow-up, and updates and coordination of care, where aspects of the patient's care were not addressed or followed up or reported, and therefore care delivery is impacted, and then at times results in actual or potential negative outcomes. So it's really important that home health agencies and hospices understand case management. We know that both the state operations manuals for home health and hospice do discuss coordination of care, the importance of the RN or in home health therapist in coordinating and leading care and ensuring that the patient's needs are being met, all aspects, not just the wound that the nurse is going in to see, or the exercises that are being provided by the therapist. That we really have to make sure that those needs are being met. And hospice, and I think I'll tag over to you when we talk about hospice, you know, it has it easier because we have an embedded IDG requirement. But at this point, with care delivery, most home health agencies should also have a component of interdisciplinary team coordination.
You know, Kim, I think you're right. I think when I think about case management and, you know, the time that I spent in the field and when I've sort of moved on and have been talking to providers out there, that concept of case management and getting it right is hard. Because that's, you know, case management's not a skill you're necessarily going to learn in either, you know, social work, school or nursing school. And when you come to an organization that you're going to work for, then it's really onus on the organization, for them to teach you what, good case management looks like for them. But, you know, I feel like case management, well, and really home-based care overall is like a gap when you're talking about, the whole schooling piece of different disciplines. And, in terms of home health and hospice, it's really, really important. If we're going to say, we're an organization that does patient-centered care, then we have to case manage all of that care so it meets the what matters for that patient.
Absolutely. And to your point, Case management is a learned skill, and not every visit clinician can be a case manager. So as an organization, really understanding how your operation wants to optimize, the skills of a case manager, of an RN or therapist in home health as a case manager, to really, whether it's a case manager who leads, several patients and manages the care, or if it is the primary care clinician in the home. In like I said, in home health, they identify the clinical manager with those responsibilities. But the reality is that it is the clinician in the field who is observing, coordinating, identifying any additional assessment and care plan needs. And also, to your point, if you have a clinician who's new to home health or hospice, community-based care, that takes time to be able to understand not just the aspects of what I need to do for a visit, what I need to do for regulation, right, for documentation. Case management is a next level skill that it really isn't something that can be given or instructed to a new staff member on day 5 or day 10.
Right.
Really have to look longer, into the clinician's orientation and training, 3 months, 6 months, and revisit it.
Yeah, and I don't know if many organizations spend the time that they need to in their onboarding and that first, I'll say year, that they bring somebody on, and really hand-holding them through, okay, this is what it means to be a case manager, and this is the framework we use, and this is why we do it, and all of those things. And it's probably, if someone out there listening has a good formula, please email us and let us know. We would love to hear about it. But I think that's probably a performance improvement area for many providers.
Absolutely.
So when we talk about the importance of case management, Kim, why is this so important to get this particular, as you say, learned skill down?
Well, remember that home health or hospice or any care setting, the goal is holistic care and ensuring that all patient needs are being met. Some examples that we've seen are, again, in survey where an agency a nurse may be focusing on the intervention of wound care and misses, some of the other aspects of care, such as medication management, psychosocial needs, maybe some mobility needs or mentation that needs that would be benefited by referring to another discipline or not knowing what the other disciplines are, the goals of care for the other disciplines are. We also have seen situations where there are patients who are behavioral health patients primarily, who all their medical needs may not be met because the focus is on behavioral health. But we also see it vice versa, right? Those patients who we have the medical needs, but they're, again, psychosocial or the mental health needs are not effectively being cared for or addressed, as well as the care coordination and care transitions. It's so important to make sure that there is evidence of that coordinating care, not just internally, but with any external resources that are also supporting the patient, including the physicians. And most importantly, it's really for the potential for improved outcomes for the patient, and again, looking at what matters to the patient when we look at age-friendly care at home. And knowing who's on, I call it knowing who's on first, right? Who's on first, knowing and coordinating each team member's goals as well as the patient's goals or family goals, and not just the specific discipline intervention, and connecting those dots and documenting.
Yeah, document, for sure. Mm-hmm. And CMS has said for years, a lot of years, that, one of their target areas were transitions in care, where they feel like that point in a patient's healthcare is a potentiality for low quality to happen. So when we fast forward then and look at case management, if we're doing good case management, then you're supporting them to pick up the thread from one provider type to your provider type, so that there isn't a gap, essentially, and a potentiality for drop in quality. So yes, it's the right thing to do, but also from a compliance standpoint, CMS has been watching this for a lot of years, and it continues to be an item of watching. So I don't know if we're, as a healthcare continuum, quite getting it right.
No, I would agree with that for sure.
And when you're talking about key considerations for those primary nurses and therapists when managing patients and families, what are you thinking when you're talking about key considerations?
That's a great question. So when it comes to case management and care management, right, of the patient, we are looking at what I'm really talking about, looking beyond just, again, the interventions on the care plan, looking more broadly at the needs of the patient and coordinating that care and being aware of the services that are being provided in that home to support the patient. Many times, I can tell you, being in the field and with agencies, when the clinicians in the home are not aware of what other disciplines are in the home and what those goals of care are. So that's happened more frequently than we'd like to see. And again, also those times when there are, the dots aren't being connected in terms of potentially negative outcomes or areas that need additional follow-up. So that's that assessment, the care planning, the facilitation of care and services, coordination and evaluation and advocacy for the patient is extremely important. And that good case management supports patient and family effective self-management when appropriate, and continuity of care that contributes to a good patient experience.
So I think it's fair to say that sort of the nuts and bolts of case management in home health and hospice kind of remain the same, and they have over the years. But there are subtle changes because, of course, healthcare has been changing, and when we think about things like AI and how that's going to impact case management, what are your thoughts about that?
I think that from a documentation standpoint, there actually are benefits, right? To be able to have these integrated EMR, systems where we can easily view, or certainly more easily than a long time ago, in terms of knowing what the care is that's being provided, what the goals are, what the care plans are. We have integrated care plans. AI, it's, early in the game, but certainly I can say that from what I've seen and what we've seen, here at CHAP is there is absolute progress, and opportunity for organizations to be able to use AI to be able to capture across the patient's care what any areas that may fall out. And also, I think it can also assist with some of the oversight, because one of the key components is we're relying on the clinicians in the field to assess, identify, report, right, observe, and document, and communicate. And we want to make sure that there is that oversight component within the organization, whether it's the clinical manager or quality, someone is looking to, or IDG in the case of hospice, right? Someone is looking to make sure that the dots are being connected, not just at the time of, I'll use hospice as an example, IDG, every 15 days, minimally every 15 days. But what I call, and I'll give a shout out to Dave Matthews, the space between, which is the space between those visits, right? That in that documentation is where, on hindsight, right, when you're reviewing, you can see where there were opportunities, for the team to be able to, or the case manager to be able to affect, to address some potential issues.
So do we agree that good case management equals better outcomes?
Absolutely. Yes, I do believe that. I've seen that, not just from a patient standpoint, but a patient health and safety, but also from survey. Because again, from when we look at survey negative findings, again, typically at the condition level or potentially IJ, immediate jeopardy, most of the time it evolves around comprehensive assessment, care planning, updates, and meeting the patient's needs.
Exactly. And I think just another item to throw in here is patient acuity. If there's a higher patient acuity, it's going to take more intensive care management or case management to ensure, the patient has everything that they need and all those threads are under control. And I think, or I hope that providers out there do adjust productivity for acuity, because there's a lot riding on it. Like you say, of course, we've got patient outcomes riding on it. We have larger things like survey riding on it, even audits, potentiality with the documentation, outcomes of an audit can ride on good case management as well.
Yep, absolutely.
So, when we think about asking our listening population out there to step up to the plate and fairly evaluate, the case management practices of their staff, what are some things that they could be asking or looking at?
Again, an organization, the goal is really to adopt an interdisciplinary care management model that reinforces care coordination and managing the patient, not just making visits. And even in hospice, where we have a pre-scripted or pre-designated IDG, there still is opportunity for the team to be able to, come together and really map out, identify the patient care needs, all of them, and ensure that they're meeting those needs or coordinating the need for to meet those needs. But in looking at for an organization determining your processes to ensure effective case management in the field, looking at what that role means, remember, case management is registered nurse or therapist, registered nurse for hospice, RN or therapist for home health. Mm-hmm. And we know that I'm going to give social workers a shout out because they have case management in their realm. They have it down pat. And they are, and they understand. So really, clinicians, home health and hospice nurses and therapists can learn from their colleagues, their social work colleagues. And therapists in general do a nice job with therapy only and communicating with each other. It's identifying those other care needs, potential nursing, etc. And again, just remembering that LPNs, as much as they are wonderful and a wonderful, aspect to the team, they are not by scope of practice case managers. So making sure that if they are making those visits, that there is that the communication and the coordination to the RN as well. So looking at who is performing case management, who do you expect to perform case management in your organization? And if it's every RN who is, managing their caseload, then you need to make sure that they have the skills and the resources to be able to understand all of the aspects of case management, and what that reporting, what that looks like to manage the needs of the patient, what your infrastructure is for interdisciplinary team or IDG, and for oversight.
Yeah, I couldn't agree with you more. And again, it circles back when you say all these things to, did the organization, first of all, if they're bringing somebody in, assess that person's case management skills, right? And additionally teach them what, that organization feels case management encompasses, and supporting them. Case management is not easy. As you know, you've done it. I've done it. Depending on, what your caseload looks like, it can be really difficult and time consuming.
And you know what? You bring up a great point. In addition to productivity, especially for those that are case managers versus visit clinicians, caseload size. Mm-hmm. That is a key component of whomever is responsible for case management. So really looking at the caseload size of those clinicians to see if they can effectively manage, all of the aspects of the patients that they have assigned to them. I just want to say also that there are many resources that are in place that are available to be able to provide case management skills or skills of the home health or hospice clinician. One in particular, but there are many, but one in particular I do want to note is Tina Morelli's books, her handbooks, because, and I will, I'm shouting out to those particular resources, because many years ago and still today, they have been used for clinicians in training, for case management and for care planning and assessment. I've used them in the field. I've used them as a clinical instructor. I've used them, certainly as a manager. But again, there are other resources as well. But you don't have to start from zero, right? There are resources. And again, I'm giving a little, the reason I also mentioned Tina is because I know that you also have co-authored, one of her, the hospice book, correct?
Yeah, absolutely. It's an honor to have worked on 2 books with, Tina. She's a legend, honestly. But, she gets it, and she's able to sort of translate what case management should look like in her Red Book and her hospice book as well, for sure.
And again, there are other resources, that are available, but I would highly encourage agencies to identify resources for training, for oversight, and for guidance, because it is again, a learned skill. The other next level component of case management, once a clinician has identified the basics, right, of home health or hospice care, and then mastering the skills of case management, looking at what I call next level case management, and that's really evaluating disease management and opportunities for, prevention of, either managing disease or prevention of exacerbation of disease, such as heart failure, COPD, diabetes, wounds. I know that here at CHAP, we have, through our Center for Excellence, we have disease program certification that, many organizations are finding are helping with framing out, if you will, the, the extension of looking beyond what I call the blinders of, the task at hand. So looking beyond, the wound care or, whatever that specific task is that the clinician is going into the home, they really are looking holistically at the patient.
Absolutely. And those programs are a great framework for organizations and their staff to follow in specific disease pathways. So, Kim, as we wrap up, what are some things that you would like our listeners to take away today?
Well, I think what we have been saying is that case management or care management by home health and hospice clinicians, RNs, and then RNs and therapists for home health is vital. It's a vital aspect of care to be able to have someone connect the dots, if you will, make sure that assessment is holistic and that all of the patient needs are being identified and addressed, whether they're being addressed directly through the agency or they're coordinated through another resource. That all needs to be documented, very well. So communication, coordination, and documentation based on those assessments and care planning of all team members is really vital. And, in doing this and making sure that these processes are in place and your staff are trained and skilled, the ultimate result is improved outcomes, and that the goal is to minimize patient care issues and potential survey findings as well.
Exactly. Great example where compliance meets quality once again. So I would invite.
That's us. That's you.
That is.
Huh?
It's the handshake, right?
There you go. Warm hug.
Well, it's been great to talk to you about this topic, Kim. I know you and I could probably talk all day about case management. I would like our listeners to share this episode as you feel you need to with the rest of your organization, and explore some of the resources or links that we have with our podcast notes, and check out our Center for Excellence to see if there are any educational offerings that we have that might enhance your staff's journey to providing great case management. So, in closing, thanks, Kim, again for teaming up with me. It's always a pleasure for us to talk, on podcast or off podcast. It's always great to spend time with you.
Absolutely.
And thanks to all of you out there in podcast land for taking time out of your day, to plug in to our episode about case management. From Kim, me, and the entire CHAP staff, keep your quality needle moving forward. Stay safe and well, and thanks for all you do.